According to the National Health, Nutrition, and Examination Surveys of 2009 to 2010, over 69% of American adults are considered overweight or obese. In fact, 78 million adults are considered obese, according to Ogden et al. In 2014. That's like filling the 10 largest stadiums in the United States, according to Wikipedia, and then multiplying that times 73.3. That's an astounding number. Now, research suggests that weight loss, which lowers BMI, is beneficial for people who are overweight, obese, because it lowers their risk of developing diabetes and reduced medical costs. The main points I will cover today are that more Americans than ever are overweight or obese. And second, being overweight or obese results in elevated BMI, which is linked to increased incidence of diabetes, a leading cause of death in Americans. In addition, weight loss, which lowers BMI for overweight and obese adults, gives a lower rate of diagnosis of diabetes and better control of diabetes for those already diagnosed. And lastly, community education to improve Americans' lifestyle choices can help lower current rates of overweight and obese adults in America and promote healthy choices for future generations. Now, what is BMI? According to the National Heart, Lung, and Blood Institute, furthermore referred to as the NHLBI, in its publication, Aim for a Healthy Weight, it's a mathematical calculation that takes into account one's height and weight to determine an index by which your overweight status is classified. Now, normal weight should be between 18.5 and 24.9 BMI. You are considered overweight at 25.0 through 29.9, and anything over 30.0 BMI is considered obese, according to the NHLBI's publication in 2013. You will also see that men with a waist circumference of 40 inches or above and women with a waist circumference of 35 inches or above are at an even higher risk of developing diabetes or other comorbidities due to being overweight or obese. Now, the NHLBI also indicated that the CDC's recommendation is that the BMI is effective because it only requires height and weight. It's inexpensive and easy to use on both for clinicians and the public, and it's a normed index that is not complicated to use. According to the 2014 publication, Prevalence of Childhood and Adult Obesity in the U.S., Ogden et al. Said that elevated BMI is linked to increased incidence of diabetes, which is a leading cause of death in the United States. Now, according to the Merriam-Webster Dictionary, diabetes is a serious disease in which the body cannot properly control sugar in the blood because it does not have enough insulin. The American Diabetes Association, also known as the ADA, indicates that long-term effects of diabetes can include sleep apnea, eyesight problems, cardiovascular disease, kidney failure, and even premature death. In the 2014 article, Journal of the American Medical Association, Ogden et al. Also found that overweight or obese people are at a higher risk of developing type 2 diabetes. In their publication, The Cost of Diabetes, the AHA showed that healthcare costs are surging. In fact, this is because of type 2 diabetes and overweight and obese people. The AHA also further asserted that California was #1 in the nation for the population of diabetic persons and #1 in healthcare costs related to such, surging over 27.9 billion dollars a year, with Florida right behind them with over almost $19 billion a year in cost, though they had the 4th largest population of diabetics. In addition, in their 2013 publication in Diabetes Care, Young et al. Indicated that there was a rising cost of U.S. diabetes-related health care, rising from $174 billion to $245 billion in only 5 years, from 2007 to 2012, giving an increase of over 41% in 5 short years. Now, there is good news. The good news is that according to Caruso-Soria and Sauer's 2010 publication, weight loss in obese or overweight persons reduces their BMI and leads to a lowered risk of developing diabetes. Now, the ADA and the AHA have both supported this claim, and they also indicate that the path to wellness is to adopt a healthier lifestyle, lowering your caloric intake by 500 calories a day and exercising moderately daily for slow to moderate weight loss. Now, this weight loss is to reduce your BMI, which, according to the Caruso-Soria and Sauer's report, will lower your chance of developing obesity-related diseases like diabetes, and it would improve your long-term outcomes. Now, the ADA has also indicated that community education is critical to the improvement of healthcare in the United States. Now, they have said that if we speak about the risk factors and promoting a healthy lifestyle, we can be more effective in lowering the current rates and elevated BMI and encouraging healthy lifestyles in young Americans. The ADA and AHA also endorsed the combination of this diet and exercise, and with the NFL's Play 60 program, are helping to push young Americans to play outside for at least 60 minutes a day as recommended, and with adults to do the same for approximately 30 minutes a day. Now, this is an issue dear to my heart because I recently have lost 70 pounds, bringing my weight from almost 300 pounds and increasing my health and reducing my risk of diabetes, or since I already have it, of health-related issues. I'd like to reiterate that research suggests that weight loss, which lowers BMI, is beneficial for people who are overweight and obese because it reduces their risk of developing diabetes and it reduces medical costs. I'd like to also reiterate the points we've covered, that according to the NES, more Americans than ever are overweight or obese. And that second, being overweight or obese results in an elevated BMI, which is linked to increased diagnosis of diabetes, a leading cause of death in Americans. In addition, weight loss in obese or overweight people leads to a reduced BMI and lowered risk for new diagnosis of diabetes in those previously diagnosed. And lastly, that community education to improve American lifestyle choices will help lower the rates of obesity and overweight adults and promote healthy choices for future generations. These changes made by Americans today will hopefully change our future by impacting others, lowering the incidence of obese in American adults so we can have a healthier, stronger nation. I'm doing my part. Are you?